I'm here with David, one of the residents, and I'm going to demonstrate to you how to take off your dressings after shoulder surgery. Specifically, this is an arthroscopic shoulder surgery dressing. Obviously, David has his scrub top on. You can imagine this is, if this were you, you'd have this on just over bare skin. So the dressing that I put on my patients is where you have an A-strap. You'll see that there are some frayed ends that I do on purpose to help make sure that you have plenty of blood flow to the hand. So when you're ready to take these off, usually it's about 2 days after surgery. Sometimes I'll let you do it at the end of the first day after surgery.
To make it easier on someone who can't actively move their shoulder since they just had shoulder surgery, the easiest way to take this dressing off is use some scissors and just gently cut layer by layer through the Velcro A-strap that's around the shoulder. Be sure to just pull up one layer at a time and be careful not to cut the skin underneath. Underneath the multiple layers of the A-strap, you'll find several pads of gauze, and these may be saturated with some blood and some fluid, and that's completely normal. Now, as you finish cutting off the dressing, you'll notice that these gauze pads will just fall off, just like that, and you could let them fall off.
Normally you have multiple of these white big pads, you have gauze. All of this is going to be covered with some sort of bloody drainage. It's not going to be too much. You don't have to worry about that. Just take that and throw that out. And then you're going to notice you have little white Band-Aid sort of strips on your shoulder. You usually going to have at least 3 places where you have those strips. Often it's going to be 4, sometimes a little bit more. It's helpful to have some gauze, or you can get waterproof Band-Aids at the pharmacy. If you don't get those, these are something called Tegaderm dressings. And the key is that they're waterproof. They're completely plastic. You just take one of these 4x4s, gauze, and then you take the plastic waterproof dressing that you got at the pharmacy, either Tegaderm or waterproof Band-Aid or something like that.
And then you take the gauze and you place it over the area with the white Band-Aids. Make sure to cover that gauze and the white Band-Aids completely with Tegaderm or whatever waterproof dressing that you purchased at the pharmacy or obtained in the recovery unit if you were at the hospital. Now keep in mind that the Tegaderm dressing itself has to be completely surrounding the white Band-Aids and the gauze, otherwise water may leak under it. Obviously here David is wearing a scrub top for demonstration purposes, but at home you'll be changing your dressings with your top off to ensure that you get a waterproof seal on the skin.
Once this is all off, you can see the plastic is beyond where the white Band-Aids are. So as long as you have plastic covering the whole area all the way around the white Band-Aids, this is now a waterproof dressing. You can shower with this dressing on. But if it starts peeling off, and you'll notice it starts coming off a little bit, and then if you let the water get underneath there, that's not so good. So if this starts peeling off, make sure you put another dressing on top of that and keep all the edges sealed at all times. Once you have that on, you can go ahead and shower. You can leave these dressings in place after you change them on the second day until you see them in the office that everyone picks it out, unless they start getting saturated with fluid or light bleeding, in which case you can change them again.